everyone. So we are the first reporter of the topic Learners with Intellectual Disability. Together with my group mates, Miss Irishmi Orquiza and Agnes Ariate, will further discuss to us about this topic. So I want you to take down some important notes or some important information about our topic so that we can fully understand the function of this one, of how can we use this as a future educator. Before I go on with our discussion, we have here our aims and objectives. So at the end of the lesson, we are expected for the students to, the number one, to know the definition of learners with intellectual disability, to examine the different types of learners' intellectual disability, and to demonstrate the nature of intellectual disability, the prenatal causes, and its impact to learners' intellectual disability. So that would be all for our objective. So my part is to discuss to you the definition of learners with intellectual disability, as well as the types or the different types of intellectual disability. So without further ado, let's get started. Let me define to you the term intellectual disability. This refers to a group of conditions caused by various genetic disorders and affections. Intellectual disability is usually identified during childhood and has an ongoing impact on an individual's development. Intellectual disability can be defined as a significantly reduced ability to understand new or complex information, to learn new skills, and to cope up independently, including social functioning, as well as disability groups. So there are many types of intellectual disability. So I will further discuss to you later about this one. So we have here the different types or the 6 types of intellectual disability. So we have here the first one, which is the Fragile X disability. The second one, the Down syndrome disability. The third one, we have the developmental delay. The fourth one is the Prader-Willi syndrome or the PWS. The fifth one, the fetal alcohol spectrum disorder, and the last one is the environmental and other causes. The Fragile X syndrome is the most common known cause of an inherited intellectual disability worldwide. It is a genetic condition caused by a mutation or a change in DNA structure in the X chromosome. People born with Fragile X syndrome may experience a wide range of physical, developmental, behavioral, and emotional difficulties. However, the severity can be very varied. Some common signs include a developmental delay, intellectual disability, communication difficulties, and anxiety, and behaviors similar to autism, such as hand flapping, difficulty with social interactions, difficulty processing sensory information, and poor eye contact. For the second type of intellectual disability, we have here, as I mentioned a while ago, the Down syndrome disability. I know we are all familiar with this, but take note, this is not a disease or illnesses. It is a genetic disorder which occurs when someone is born with a full or partial extra copy of chromosome 21 in their DNA. So people with Down syndrome can have a range of common physical and developmental characteristics, as well as a higher than normal incidence of respiratory and heart conditions. The third one, the developmental delay. So when a child develops a slow rate compared to other children of the same age, they may have developmental delay. So one or more areas of development may be affected, including their ability to move, communicate, learn, understand, or interact with other children. We have here the Prader-Willi syndrome, PWS. It is one of the most common symptoms of PWS is a constant and insatiable hunger, which typically begins at 2 years of age. So people with WPS have an urge to eat because their brain, specifically their hypothalamus, won't tell them that they are full. So they are forever feeling hungry. So we have here the symptoms of WPS. It is quite varied, but poor muscle tone and a short structure are common. So a level of intellectual disability is also common, and children can find language, problem solving, and maths difficult. For the last one, we have the environmental and other causes. It is sometimes an intellectual disability caused by environmental factor. So these causes can be quite varied, but which include number one, maybe problems during pregnancy, such as viral or bacterial infections, complications during birth, exposure to toxins such as lead or mercury, complications from illnesses such as measles or whooping cough, and malnutrition is also dominant. Exposure to alcohol and drugs, trauma, and unknown causes. So that would be all for my part. Miss Irish Orquiza will discuss to us the nature of intellectual disability.
Good day everyone, this is Irish Orqueza and I am one of the assigned reporters with the topic Learners with Intellectual Disabilities. So now, I am going to discuss with you all about the nature of intellectual disability and its classification. So stay tuned! As future educators, it is really important to know that despite of the difficulties in a learning environment, students with intellectual disability can and do have the capacity to acquire and use new information. Now let's discuss with the nature of intellectual disability. So intellectual disability is formerly referred to us as mental retardation. Now, what is this mental retardation? Mental retardation or the intellectual disability is a term used when a person has a certain limitation in mental functioning and skills, such as in communicating, taking care of himself or herself, and social skills. Also, mental retardation is characterized by a combination of deficits in both cognitive functioning and adaptive behavior. This is also the severity of the intellectual disability is determined by the discrepancy between the individual capabilities in learning and in the expectation of the social environment. And for the information of everybody, intellectual disability is defined as a disability characterized by significant limitations in both intellectual functioning and in adaptive behavior, so which covers many everyday social and practical skills. So this results is a reduced ability to cope independently and begins before adulthood, with a lasting effect on development. Earlier in my discussion, I already mentioned intellectual functioning and adaptive behavior. Now, let's define these terms. So first is intellectual functioning. Intellectual functioning, or also called as intelligence, refers to general mental capacity such as learning, reasoning, problem solving, and so on. So one way to measure intellectual functioning is an IQ test. Generally, an IQ test score of around 70 or as high as 75 indicates a limitation in intellectual functioning. On the other hand, adaptive behavior is defined as the collection of conceptual, social, and practical skills that are learned and performed by people in their everyday lives. On the other hand also, we have here the age onset. So age onset is the condition. This is one of several developmental disabilities that is there in evidence of the disability during the developmental period, which is defined as before the age of 22 years old. We have also here the prevalence of intellectual disability. So intellectual disability is the most common developmental disability. So in the Philippines, intellectual disability compromises 7.2% of the total population of a persons with disability. This is according to National Statistics Office Census. Now moving on, we have also here the etiology and classification of intellectual disabilities. We have here the three causes, the prenatal causes, perinatal causes, and the postnatal causes. So under these three, under prenatal causes is the chromosomal disorders, inborn errors of metabolism, developmental disorders of brain formation, and of course, the environmental influences. And on the other hand, the perinatal causes is we have here anoxia, then low birth weight or the LBW, then of course the syphilis and herpes simplex. While on the postnatal causes, we have also here the biological, psychosocial, and child abuse and neglect. Now, these are the types of disorder under the causes or the different classification of causes of intellectual disability. So, for more information, this is to further discuss with you by one of my group mates, Miss Agnes Ariate. So, thank you so much for listening, and I do hope that you learned something from me. Thank you. God bless.
Hello, good day everyone. By the way, I'm Agnes Ariate and I'm the third presenter of Group 1 and we are tasked to discuss about intellectual disability. So in line with that, and I am assigned to introduce to you the classification of intellectual disability. So we have the prenatal causes, the perinatal causes, and postnatal causes. And now let's start talking about prenatal causes. So in prenatal causes, we have first the chromosomal disorder. So what do we mean by chromosomal disorders? So this is an Annie syndrome characterized by malformation or malfunctions in any of the body systems, and it is caused by abnormal chromosome number or constitution. So there are 8 types of chromosomal disorders. And now let's talk about first the Cornelia-de-Lange syndrome. Okay, so Cornelia-de-Lange syndrome, it is a congenital intellectual disability and it involves heart defects, hearing loss, and abnormalities of fingers and hands. And also, it manifests self-injurious behavior. So, the picture shown in the screen, this is an example of Cornelia-de-Lange syndrome, right? So, the hands of the children are abnormal. So, this is an example of Cornelia-de-Lange syndrome. Next, we have the Cri-du-Chat syndrome. So, unsa man siya? So, Cri-du-Chat syndrome, this is occur when the baby have difficulty in swallowing and sucking. Also, if have low birth weight and poor growth. Also, unusual facial features and hyperactive, aggressive, and repetitive movements. So, Cri-du-Chat syndrome caused by missing section on a particular chromosome known as chromosome 5. So, if the baby don't have the chromosome 5, therefore, he or she will get this Cri-du-Chat syndrome. So, this is an example of the facial features of having Cri-du-Chat syndrome. Okay, so now let's move on to Down syndrome. So Down syndrome, also referred to as trisomy 21. So it is usually not an inherited condition. So the most common type of chromosomal disorders. So the Down syndrome is the most common type of chromosomal disorders, and it involves the anomaly at 21st set of chromosomes. And people with Down syndrome exhibits unusual facial features and with broad hands with short fingers. So like Adler's syndrome, the Down syndrome also have unusual facial features, and as you can see in the picture, the baby have broad hands with short fingers. So this is an example of Down syndrome. Okay, so now let's move on to Klinefelter's syndrome. So Klinefelter syndrome, this is sterility in mean. So this will decrease an IQ, have poor coordination, and have skeletal abnormalities. Okay, so Klinefelter syndrome also caused by additional X chromosome. So if a baby have an additional X chromosome, therefore he or she will experience will get Klinefelter's syndrome. Next, we have Turner syndrome. So Turner syndrome normally found in females. So you don't actually find it in males, but normally in females. So persons with Turner syndrome has swimming of the neck, puffiness or swelling of hands and feet. So as you can see in the picture shown in screen, the baby is swelling of her hand, right? So it is associated with heart defects and kidney problems. So Turner syndrome are caused by partial or complete loss of the second sex chromosome. So that's the cause of Turner syndrome. Next, we have the Williams syndrome. So Williams syndrome caused by absence of material on the 7th pair of chromosomes. So people with Williams syndrome exhibit heart defects and elfin facial features. So what do you mean by elfin facial features? So it is a form of faces where the patient presents with facial characteristics bearing some similarities to those traditionally associated with elves. So that's what we mean, elfin facial features. So their unusual sensitivity to sound makes them competent in music and language despite of their low IQ level. So although the Williams syndrome have their low IQ level, no, but then they are competent in music. It's because they are sensitive to sounds. They have sensitivity to sounds. That's why they are competent in music. Okay, so that's Williams syndrome. Now let's proceed to Fragile X syndrome. So Fragile X syndrome, most commonly known as hereditary cause of intellectual disability. So it is associated with X chromosomes and 23rd pair of chromosomes. It occurs less often in females, right? And persons with Fragile X syndrome have behavior and emotional problems and poor social skills. So they don't actually want to interact with others. Kaya naman, they have poor socialization skills according to the statement. And they become anxious with routines are changed, and they have unusual facial features also. So like other syndrome, this Fragile X syndrome also have unusual facial features. Okay? So that's all about chromosome disorders. So those are the types of chromosomal disorders. Okay, next we have inborn errors of metabolism. So inborn errors of metabolism are genetic conditions that block metabolic pathways involved in breakdown of nutrients and the generation of energy. So we have first galactosemia, Hunter syndrome, we have phenylketonuria, and Tay-Sachs diseases. Okay, so galactosemia, it is an inability of the body to use simple sugar, galactose. And Hunter syndrome, defective breakdown of chemical mucopolysaccharide. Okay, and also the next, the phenylketonuria, it is an ability of the body to convert phenylalanine to tyrosine. And next, we have Tay-Sachs disease is the absence of HEX-A enzyme. Okay, moving forward. So we are now in developmental disorders of brain formation. So there are two disorders of brain formation. We have the microcephalus and the hydrocephalus. Okay, so see microcephalus, this is an intellectual disability, usually ranges from severe to profound. And this disorder has no specific treatment, and the life expectancy is low. Okay? So, ano siya? And then, si microcephalus or si microcephaly, it is a birth defect where a body's head is smaller and expected with compared to babies of the same sex and age. So, as you can see in the picture, it is shown example of the microcephalus, having microcephalus. So, the head is smaller than expected with compared to babies of the same sex and age, right? The babies with microcephaly often have smaller brains that might not have developed properly. So that's why na siya gamay nga ulo. that's why gamay yung head, it's because gamay pud iyang brain na wala siya na develop properly. Okay? So that's the cause of microcephalus. Okay, so next we have the hydrocephalus. So if si microcephalus kay gamay ang ulo, but si hydrocephalus murag kaning dako iyang ulo. Okay, so the results from an accumulation of cerebrospinal fluid inside or outside the brain. So the degree of intellectual disability depends on how early the condition is diagnosed and treated. Okay, so si hydrocephalus caused by imbalance between how much cerebrospinal fluid is produced and how much is absorbed into the bloodstream. So hydrocephalus has no cure, but there are treatments that allow affected to live fairly normal lives with condition. Okay, so that's the two developmental disorders of brain formation, si microcephalus and hydrocephalus. And now let's proceed to environmental influences. Okay, so first we have the maternal malnutrition and infection. And next we have fetal alcohol syndrome. So fetal alcohol syndrome, it is a condition in a child that result from alcohol exposure during the mother's pregnancy. So if a mommy ma-expose siya sa kaning alcohol while she's pregnant, therefore makuha ni siya nga syndrome, si fetal alcohol syndrome. So this syndrome causes brain damage and growth problems. So that's why magkakause og any syndrome ang isa ka baby. It's because of the influence of our environment. Like for example, ma-expose ta sa kaning alcohol. So si mommy di siya aware ana. So magkakause di siyang syndrome if ma-expose ka sa alcohol while pregnant ka. Okay? Also if next is the lead exposure. So, ma-expose po ta sa lead, no? Magka-cause po na siya kaning syndrome. So, it can seriously harm, kaning lead exposure, can seriously harm child's health, including damage to their brain and nervous system, slowed growth and development, learning and behavior problems, and hearing and speech problems. So, if not sa lead exposure, ma-damage po ang brain sa isa ka baby and the nervous system, slowed and growth nila and development, napod siya makuan po iyahang learning and behavior problems and hearing and speech problems. So ana ang cause if nasa ta sa lead exposure. Then also illicit drug exposure, na po na siya cause exposure to radiation, and also we napod tayo ginatawag nga Rabilla syndrome. So it is an illness in infants that results from maternal infection with Rabilla virus during pregnancy. So when Rabilla infection occurs during early pregnancy, serious consequences such as miscarriages, stillbirths, and constellation of severe birth defects in infants can result. So that's the consequences if the pregnant mom will experience Rabilla syndrome. Okay, now so we're done in prenatal causes, and now let's proceed to perinatal causes. So we have here anoxia, the low birth weight, and syphilis and herpes simplex. So anoxia describes an absence of oxygen reaching the tissues. Infants may be deprived of oxygen around the time of birth and sustain hypoxic brain damage. So ano siya? Then we have the low birth weight, and then syphilis and herpes simplex. It is a virus, no? Virus ni siya. Herpes simplex virus type 2 and syphilis are common sexually transmitted infections. So si herpes simplex virus seropositive individuals have a lifelong risk of infecting their sexual partners. Okay, so because of prenatal causes, the probability that a baby is a person will get this syndromes or they will experience the intellectual disability. Okay. So lastly, we have the postnatal causes. So a person will experience intellectual disability if this postnatal causes occur. So we have the environmental and psychosocial problems. Because of this, natin ma-experience nga intellectual disability because of environmental and psychosocial problems. First, we have the nutritional problems. Okay? Especially problems sa nutrition, therefore, maka-experience kag intellectual disability. We have adverse living conditions. We have also an inadequate health care, the lack of early cognitive stimulation, the child abuse and neglect. So, child abuse and neglect is one of the reasons why a person will experience kaning intellectual disability pod. And traumatic brain injury o sa trauma ka. So, ano po siya, one of the reason na nung natay intellectual disability. And also, the meningitis or encephalitis. Okay, na po siya. And then, lead poisoning. So these are the reason why kani sa environmental and psychosocial problems, a person will experience intellectual disability. Okay, that's it everyone. So thank you for listening. I hope you gain a lot of knowledge about our discussion today. So for the assessment of your learnings, try to answer these questions shown in the screen to measure your learnings and knowledge about intellectual disability. So that's it. Goodbye and keep safe always.